We can have kids who they're mistaken to have dyslexia or ADHD, and sometimes it is just vision issues. One very interesting kiddo that like left a really big mark on me kind of early in my career. My first job that I had outside of after graduating was working in the public school system in Memphis and getting to like see kids in the schools. It was a really fun job. Pretty hectic, like traveling to new schools all the time. But every once in a while I would get to like return to schools and get updates on some of the kiddos that I had seen. And I had this kiddo who came into me and he was in third grade in special education courses, had never had an eye exam, and we got him in. He had an incredibly high prescription and got him some glasses. Didn't think much of it at the time, but I happened to be back at that school about 6 months later. And one of his teachers came in and talked to me, and he had been taken out of his special education courses. His behavior had improved. He wasn't acting out in the classroom anymore. He was a smart kiddo. He just couldn't see anything. So yeah, and that's obviously like a pretty dramatic example, but a lot of things can be mistaken for other things going on in the brain. When it can be the eyes, they can have that dramatic of an effect on kids' behavior and learning and their attention.
Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Today, I'm joined by someone our family knows and is very grateful for, Dr. Rohr, an incredible optometrist at Summit Vision Care, who cares for patients for all ages with a special passion for children's vision. Dr. Rohr earned her doctorate in optometry from Southern College of Optometry and has spent years serving families, including some time providing care to children in underserved communities. She has a unique lens, no pun intended, on how vision impacts learning and development. And fun fact, we were actually in her office just last week when one of my kids had a reaction to something. And as always, Dr. Rohr handled it with calmness and care. And I can't wait for you to hear from her today as we are diving into learning more about children's vision. Welcome, Dr. Rohr.
Thank you.
Looking forward to our conversation today. Dr. Rohr, can you start by telling us a little bit about your journey into optometry and essentially landing here in Erie?
Yeah, so I knew from a pretty young age that I wanted to be in healthcare of some form. Always really enjoyed the sciences and have been someone that, even outside of like my job, I really like taking care of the people around me, doing things for them to help them in ways they need, right? So I, for a super long time, was like, I'm going to be a dentist. I was so stuck on it. I said it for years to everyone until my junior year of college, as I'm getting ready to take an entrance exam and apply to these schools. I realized I was like pretty unexcited about teeth. Just wasn't really inspiring me much. And I figured if I'm not excited about it now, I don't know when that would change.
Right, a long career in it.
So I had a great counselor at my college who, got me to shadow just a ton of different healthcare providers and get a little more exposure to maybe things I just hadn't considered. Thought about all the different routes, and honestly, it came down to the fact that every optometrist I ended up meeting really seemed to love their job. They told me really consistently they would choose it again, that, some of them were 75 years old and still working and really loved it. I think it gives a really nice balance of like, I'm in the healthcare field. I get to do some really interesting and helpful things, but it's also lower stress in comparison. It gives me a really good balance with my life outside of work. So honestly, yeah, I met a lot of really happy optometrists, and that's why I applied, which maybe not like the most responsible reason to get into something, but it's ended up working out really well. I'm 8 years in practicing now, and I still really love it. I enjoy coming to work and enjoy being here a lot. Kids in particular was a sort of an interesting change. I can't say I had a lot of experience with kids prior to school. I didn't have like family members or friends with kids, and I didn't really know if I liked them. And we started doing school screenings kind of early in school before you're allowed to do full exams. And I realized when we left these screenings, most of my classmates were like, that was exhausting. That was horrible. I hated it. And I was like, I feel energized. I loved that. Like, it's so fun to spend time with kids. Just kind of ran from there with it and kept doing more in pediatrics with, my internships and my jobs and stuff. So I just enjoyed the kids the most. Erie in particular was kind of just fell into my lap. I have a sister who I'm very close with who moved to Colorado about 12 years ago now. And she actually has been in Erie for a good part of that. And I just by like word of mouth had heard that Dr. Kennedy, the owner of our practice, was hiring, met with him. The office happened to be about a mile away from my sister's house and decided like, I have to leave Tennessee, I'm moving. And so part of it is definitely just family. Part of it is I have a wonderful boss. He makes this job really wonderful. So I think meeting him, it just confirmed that I wanted to move here. And I feel pretty lucky because now I get a pretty wonderful base of patients. This town's pretty good to work in. Great family. So definitely being here just sort of happened and it's worked out really well.
Well, that's awesome. And we're very grateful that you landed here at Summit Vision Care. Like I said, all three of my kids see you, and it's been a joy getting to know you over the last couple of years. And then going back to like choosing your career path too. Yeah. As we were talking before we had started recording this, optometry, like you said, it's not super stressful, but you're still in the healthcare space. Sometimes you can even help, diagnose, or not necessarily diagnose things, but bring things up to people that you notice, and then they can get referred to specialists based on what you see, just because the eyes do tell you a lot about someone's health. And grateful you get the like work-life balance too, because you enjoy hiking and all that stuff, like Colorado.
All Colorado things, yes.
So in terms of working in eye care, what do you love most about it, and also helping people, improve their vision and overall health?
Yeah. Eye care is really cool because I think, you're helping people with a sense that I think all of us understand is really irreplaceable. Everyone understands that like losing vision is terrible. And even if people come in here with these, like, I'm just having a small change, even helping make the vision slightly better, people tend to be pretty grateful for. It affects things we do every single day. It affects our comfort at work. It affects our ability to enjoy our hobbies and the things that make us happy. Getting to put a pair of glasses on a kid for the first time and like the smiles you get out of it is pretty cool. It's really cool, actually. Some of what I really love most, though, it does kind of come back to this, like the field itself. And this isn't true across, all of eye care. There are parts of eye care that are much more stressful and you are dealing with difficult discussions and diagnoses for patients. But being in sort of like a primary care optometry office, it does come back to this, like, I have the space and the time to be, I think, a little more available for my patients. One thing that in, my not super long-lived career, but something I've really tried to prioritize is like always giving as much time as a patient's needs, as long as my schedule allows it. I have some people who want to be in and out of here really fast, totally fine. I'm going to make sure I still answer their questions. I get other people who they maybe had some difficult healthcare experiences and, they're maybe coming into me with a little hesitation, especially when they're new to me, they don't trust me yet. I really want to give them every minute that they could need to hopefully leave here feeling more educated on sometimes not just their eyes, but other parts of their health, feeling really comfortable asking questions. I think when I have patients who feel that, it just makes them better patients. They're going to be more motivated to take care of themselves. They're going to stay healthier for longer. And I just don't think that is possible in like every realm of healthcare, right? Like some providers are just so busy. They don't have the time to do that. And it's not their fault. They have a lot of constrictions to their day. But because of my job being, a little lower stress, not too many like life or death situations. I have the time to talk and hopefully help people be just more informed about things that sometimes seem simple. It might just seem like glasses, but it's just a lot bigger than that.
So Dr. Kennedy covered a lot about more of an adult vision things that happen as kind of we age. Today we're going to be talking a little bit more about children's eye health. So can you walk us through the timeline of vision development in children and what changes should parents expect at different stages?
Absolutely. We get a lot of change kind of in the first couple of years. When we look at things kind of this like birth to 4 months, honestly, eyes are not great. They're not seeing great. They can see like really high contrast, colorful objects, large objects, but their world is really this kind of like 8 to 10 inches from their face. Their vision is not good. In fact, they're born pretty often with pretty high prescriptions, what numbers that I think adults sometimes hear and go, isn't that bad? But it is normal when we're born. We see that the eyes are really bad at working together in the beginning too. So noticing babies, newborns who have eyes that are like wandering, they may even cross from time to time, and that can be completely normal. We're learning how to use these muscles. We're learning how to use them together and make our eyes work as a team. And again, it's just not very good in the beginning. So when it comes to eye crossing, I always tell families too, if you're seeing it really consistently and constantly, get the eyes checked. But if you're just noticing like, oh, one of the eyes is turning in when we're really tired or when we get sick, and it happens for a few seconds and then it goes away, honestly, those things aren't too concerning. That's pretty normal. They're definitely going to be more interested in sounds early on too. So don't be alarmed if they're like not seeing you right when you walk in a room. It's just vision is not great in those first like couple of months. After that, once we hit kind of this like 5 to 8 month stage, we see a lot more of the kind of advanced visual skills develop more. So one of those big ones is going to be depth perception. That like 3D vision or ability to see kind of how far away something is from us is really going to start changing there. This is going to be really important for them, like grabbing at objects, reaching out and grasping things. They're going to get better at like, where's that target at and actually hitting it and getting things in their hands. Additionally, too, crawling is really important here. So when we start to hit the crawling stage, this is very, very helpful for eye-hand coordination and continuing the depth perception growth. In fact, there are some studies that show that kids who walk early and maybe don't get through enough months of crawling often can struggle with like binocular vision or just that ability to use the eyes really well together. It can be decreased throughout life. We really don't want to encourage kids to walk any younger than they want to. We want them to get some crawling in. It's really important for eye development, actually.
Oh, that's so interesting.
This is super interesting. They're also going to start recognizing, like familiar faces and some objects in this stage, which, you start getting the smiles when they see you, which is always really fun. And then also too, color vision is going to start developing kind of this 5 to 8 month range. After that, we look kind of those last few months of the first year. These same things, they just kind of keep improving. We're going to get better at judging distances. Like we might even start seeing them throw an object a little more precisely. They're going to be able to start grasping things better with their thumbs and their forefingers. And some of that comes from vision. It's not just motor, but visual motor, right? And we're also going to get good at like tracking things at quicker speeds, like seeing people walking and being able to follow them. After that, it's really a lot of this continued, like our eye muscles just get better. From 1 to 2 years, it'll be some more vision perception, recognizing objects in a book and being able to decide what they are. I really love in like this 1 to 2 age, a task that seems small, but is really helpful is actually just like rolling a ball back and forth. That is going to help them with tracking, watching that ball roll away from them, roll back to them. And then eye-hand coordination is helpful there. And also too, we're going to start developing this better ability kind of in that first, our age 1 to 2, where we can see things far away and up close. Our world really is just in this near zone when we're born, and it just kind of gradually expands throughout those first couple of years. So that way, by the time we reach kind of age 2, 3, 4, we're going to actually see them nearing that 20/20 vision, or that vision we want everyone to have. 4 to 6 years old is kind of where a lot of things finish up. We're going to start preparing for reading. We're going to start seeing like the complete depth perception be established, and vision's pretty developed at that point. Now there's still a lot of things in terms of like brain development that is not solidified, but a lot of the skills that our eyes have kind of at 4, 5, 6 is where we'll see it stop.
Okay. Yeah. That's also interesting. And I noticed when my kids were little that they, would kind of track offwards with their eyes and look like that. So it's comforting if there's new parents listening to this podcast episode, like as long as it's not super reoccurring and all the time, like it's totally normal. So don't be freaking out. Cause I think me and my husband, now that you said that, I feel like there was some concern, especially with our first two, like what's going on with their eyes when they would, kind of look in different directions.
Yes. Well, and I would also say, go ahead.
No, you're fine. Go ahead.
So I would say that I have a lot of parents who will come in with like photos of their kid and they'll be like, look, their head's like turned all the way to the side and their eyes are funny. And I'm like, that's okay. Always like if the turn is happening, we want to like think about it and just like looking straight ahead. That gaze is what we worry about. So sometimes if they're like in a funny head position and one of the eyes looks, don't worry about it. It's fine. It's always still like straight ahead. That's really important. And gives us the idea of like, is the eye actually turning or aligning incorrectly a little better?
And it's good to know too, that crawling is important because I feel like sometimes, especially with your like first or second, like you're always kind of comparing like where your kids are at developmentally to other kids. And, you start to see kids like by their like, 8, 9 months and you're like, oh man, they're starting to walk and mine isn't yet. And then you're like starting to worry, but it's like, it's actually better for their vision to be crawling a little bit more. So that's comforting too.
Well, and just like all of the other developmental milestones that like our pediatricians are going to talk about, these are variable and it can still be normal. Like just because we have these general guidelines of when certain things should happen with vision, if we're a couple months off, it doesn't mean there's anything wrong. Our bodies are going to develop at different rates. And these are just kind of general guidelines. So, yeah.
And then to summarize, you said roughly around age 6 is when the eyes have kind of like fully developed. They are getting close to that 20/20 vision. Yeah.
Around that 6 years old, we're going to see that the prescription should hopefully be stabilizing towards a more normal or no prescription. Again, born with these really high amounts and they kind of drop throughout the first 6 years of life. So getting closer to that 20/20 vision. And then also too, just the ability to control all of the muscles that work in the eye improve to a point where we should see tracking abilities and focusing abilities just should be pretty normal or close to how we'll see them even as adults if they're working properly. Yeah.
How many muscles are in the eye?
So we've got 6 that surround it on the outside, and those do kind of all the movements, right, to move the eyes in a certain direction. There's also the one internally. That one's kind of forgotten about sometimes. The muscle inside the eye actually does our focusing ability for us. It kind of turns on and contracts for us to do near work, and that one's super important.
Interesting. So when should a child have their first eye exam, and how do the infant eye exams, because they test them at like in the hospital, right? I'm trying to remember like the different eye exams, but
I think sometimes they're doing them in the hospitals, but only in certain cases, I believe. Like if
because I guess it's just hearing, right? That they do a lot of times before they release you. Okay.
Yes. So kind of hard to believe because I think most of us don't get our first exam until either like something's wrong or, we're just a little bit older, but it is recommended to have the first exam during the first year of life. Our office is part of a group called Infancy that provides free eye exams for any kid, regardless of insurance status, under the age of 1. So I really love having kids come in around like 9 months old. I think they're just a little more interactive. It's a little more fun, but I definitely feel comfortable seeing kids sooner if there's concerns that come up sooner. Infant eye exams are really fun. They're super interesting. So we're able to obtain all the same information that we can during an adult exam. we're not getting feedback from them, right? I'm kind of depending on all my skills to get the information I need. It requires a lot of like really interesting targets using movies and things that light up and move and things that are really colorful, just interesting things. Sometimes I'll attempt to like sing or make animal noises. That's not always great, but it works and it helps. So we can start just with like the prescription piece. I'm basically going to use a flashlight, some lenses, kind of like what we would put in a pair of glasses. And I'm getting like a reflection from the back of the eye, and I can figure out what the prescription is from there. This one's fun because it's a really basic skill in optometry that we all learn how to do, but a lot of people think it's like magic that I can do it. That one's pretty interesting. Infant exams do require the use of dilation drops, which like I know we're never excited to put drops in babies' eyes. They tend to cry. They tend to not like them. But we really just can't get any of this information without dilating them. With adults, we're using the drops just to get health information, to see the retina, the inside of the eye. But with kids, what it also does is help me find that prescription. If you've ever been dilated and you're like, oh, things are really blurry afterwards, that drop actually kind of deactivates that internal muscle we were talking about that focuses for us. And so it just lets me see the entirety of the prescription rather than that kiddo like trying to focus on me and looking up close. I can just sort of knock it out of the way and just get the prescription that way. Then we're also going to check the alignment, the muscles, make sure their eyes are moving appropriately. And then we get the full health check too, checking inside, outside of the eyes, making sure the retina and the front surface look good. So yeah, all the same stuff. It's just done in a very different way and a little more fun, I think.
As you were talking, I was thinking, is there any genetic component to vision? Like if both parents have really bad vision, is there chances of your child having vision problems, or is like, what is that?
Certainly. Yeah. Prescription wise, yes. It's not 100% guarantee. You know, if you've got two parents who have bad vision, like in nearsightedness, for instance, the risk is about 50% for your kids. So I have families who like both parents have bad eyes, but somehow the kids are fine.
Yeah, that's my family. My parents have had glasses for a long time, and I somehow, fingers crossed, have still not had to have anything yet.
Yeah. So it's not a guarantee. I mean, I came from a family where my parents have great eyes. My mom's got like a tiny prescription. My dad doesn't wear glasses. I'm the only one who does. It's just me. So they can happen from other reasons, but genetics play a role. It can affect prescription. It can affect different health conditions in the eye can certainly be genetic as well. But it definitely plays a role.
Okay.
Yeah.
Okay. So we now know that it is important actually to have your babies checked. Can we talk a little bit about the school exams versus like the comprehensive eye exams that you actually do inside of your practice?
Yeah, absolutely. Screenings are really valuable encounters, and especially school-based screenings. Like that is so accessible, right? Like we're getting something done in school in a place we're already at. So they are certainly valuable, but it's just not a one-to-one replacement for a complete exam. When we look at the way they perform the screenings, it's usually one of two ways. The kind of old school way would just be like reading a chart on the wall. This is really only going to catch the kids who are nearsighted, who can't see far away. We can have kids who actually have pretty high prescriptions, both in astigmatism or in farsightedness, and they may see 20/20. It just doesn't detect for everything. The newer way of doing the exams, though, there's often these tools that it's like a little box. They come in, they take a picture of the kids, it gets a printout. These are a little more accurate. This tool actually really mimics a device we use in our office. If you've ever seen like the farmhouse or the hot air balloon and it kind of gets blurry and clear, that's the same thing. It is the same technology, but they're just not 100%. You know, sometimes I'll get those readings from my machine and it is so far off because there are so many things that can affect that reading. So it's like our screenings are just only looking at glasses prescription, which is obviously a big part of all this, but it's not going to catch all of it. And it's not doing anything in terms of eye health either. Very unfortunately, we can have kids who have diseases in the eyes, and it doesn't always mean that we're not 20/20. 20/20 or that like good vision that we want, it really just represents that we have good central vision that can see. But there are a lot of other parts of the eye that can be unhealthy and not impact vision until maybe they're a little more advanced. So coming in for an exam with us, yes, we're going to check that glasses prescription. It's also going to be more accurate. I get some kids who are flagged on screenings and are completely fine. And so I kind of have to assume the opposite, where there's some kids who pass the screenings and they need glasses as well. But we're also going to be checking that eye health. And luckily, vast majority of the time, everything's good. Kids' eyes are healthy. I have had some occurrences where we catch something that we're catching it early and hopefully we're intervening really early. Or sometimes we delayed an eye exam for too long and it's already really affected vision, which is never fun. But
not to like scare parents, but what are some things that you could potentially find?
Yeah. So I've had a few things show up in retinal health that are, they're hard conversations because sometimes they're permanent changes. I had one last year that's really been weighing on me a lot. It was a kiddo who had been getting screenings through their pediatrician. And they were passing him every year, but the year prior to coming in to see me, the vision had started to decline just slightly on one eye, not enough to alarm the doctor, because it was only like one line of difference. So going from 2020 just to up a line to 2025, nothing dramatic. It happens in kids. Reading the letters kind of boring, nothing to really worry about. Again, it's just that those letters are not like a tell-all. Ended up coming into us, and at the beginning of the exam said, I feel good. I feel like I see well. And as we're trying to do the glasses prescription on one of the eyes, I just cannot get him to see anything. We're like 2200 on that side, and it's not really a prescription problem. So we go to do the retinal health portion, and we have this incredibly large scarring situation right over the central vision. And as we talked about it more, this kid's pretty young, and he's like, I think maybe I've noticed it for a little while, but I'm not sure. He's got one eye that's working really well, so it wasn't really bothering him. And so it was off to a retina specialist and some surgical medication treatments. The expectation is we'll never really get that eye to see well. So there's just kind of permanent damage there. But something that could have been caught sooner if we had been doing full eye exams instead of just screenings. Yeah. Occasionally too, there can be front eye stuff going on. So I'll get some like eyelids that are turned a little funny and the eyelashes are scratching the front surface of the eye and it's creating a really foggy situation. They're kind of few and far between and they're always kind of interesting, but a lot of times it ends up being that we have one eye that's not affected and one that is. And so we just don't really notice because we've got one eye that's fine.
Do you ever have issues? You helped me because I have really long eyelashes. And one of my issues is sometimes my eyelashes will curve into my eyes, causing it to scratch. Do you have, I'm sure there's a lot of kids too that have maybe even some eyelash things that pop up, things like that.
Yeah. One of them was just the eyelid was kind of positioned a little funny. And so the eyelashes grew out straight, but they were pushed backwards because of the positioning of the eyelid itself. So we had the eyelids surgically changed so that they sat differently and there wasn't problems anymore. And then, some kids, it's a lot of the boys always, but they just have so many eyelashes. And a lot of times
big, beautiful eyelashes.
I know, every time. They're just so unbothered. They're like, I'm fine. I don't feel anything. So we search for this stuff sometimes.
Well, I'm looking forward to your response to this question because I feel like this is kind of the meat and potatoes of this discussion. But so most people think vision is just about being 20/20, but there's so much more when it comes to reading and learning. So in your opinion, what visual skills are essential for success in the classroom and how can we help our kids making sure that we're supporting them?
Yeah, that 20/20 is really important. We have to see clearly to learn about things, right? But having that on its own is just not enough. Our eyes do a lot of pretty complicated tasks. And I think reading is a really useful tool to use here to explain all of it. So reading is pretty complicated for our eyes. We have to have them moving together, right? So we have different types of eye movements, and during reading, one of them is making these jump movements across the page. Sometimes this doesn't work well. We'll see kids kind of going back and rereading things, skipping around a lot. having to use their finger to read. And when we're getting this information really broken up, it leads to like decreased comprehension. We have to have the eyes focusing really well. So that like internal eye muscle, I'll see in a lot of kids that it's either a little too lazy, it's a little too strong, it might be acting just really erratically, or it's kind of incapable of like sustaining the flexing movement it needs to read for long periods of time. So sometimes these kids are just gonna give up on reading. Like it's just so much work and they're gonna seem not interested, but in reality, it could just be that it's really hard for them. We also need to make sure that the eyes turn in together when we're looking at things up close. Those eyes turn in, and this ability to turn all the way sometimes is difficult for kids. And these things all interact together. So sometimes it can be that just like one of them's not working well, but it makes the other ones hard as well too. So even then, when we move past just like eyes themselves and how the eyes work, it's also how's that information being utilized once it gets back to the brain. Is our visual processing, is our visual integration working correctly? Does then that also come out with good visual motor skills where we can write comfortably? There's so many steps along the way that kind of make academic success possible. And yeah, even if you just have one missing, it can make all of school feel hard. It can lead to, attention issues and behavioral issues as well. It's frustrating, and it can be hard for them to explain to us too.
So if you feel like your kids might be having some learning difficulties or some attention issues, like having their eyes looked at and seeing, are their visual skills where they should be, because that could potentially be a contributor.
Absolutely. Yeah. I think a lot of our pediatricians are great about this. They'll, if we are having concerns in school, having testing done for learning difficulties, a lot of them are going to tell you, get your eyes checked, like check that off the list too. We can have kids who they're mistaken to have dyslexia or ADHD, and sometimes it is just vision issues. One very interesting kiddo that like left a really big mark on me kind of early in my career. My first job that I had outside of after graduating was working in the public school system in Memphis and getting to like see kids in the schools. It was a really fun job, pretty hectic, like traveling to new schools all the time. But every once in a while I would get to like return to schools and get updates on some of the kiddos that I had seen. And I had this kiddo who came into me, and he was in third grade in special education courses, had never had an eye exam, and we got him in. He had an incredibly high prescription, and got him some glasses. Didn't think much of it at the time, but I happened to be back at that school about 6 months later. And one of his teachers came in and talked to me, and he had been taken out of his special education courses. His behavior had improved. He wasn't acting out in the classroom anymore. He was a smart kiddo. He just couldn't see anything. So yeah, and that's obviously like a pretty dramatic example, but a lot of things can be mistaken for other things going on in the brain. When it can be the eyes, they can have that dramatic of an effect on kids' behavior and learning and their attention.
Wow, that's incredible. But it's so cool that she shared that with you, that, in just a short amount of time, no longer needing services. And
sometimes I don't get to hear what happens to people when I see them. In this setting, it's a little different. I see a lot of people year to year, but every once in a while I have a patient who shows up for one exam and I never see him again. I may refer them off to a specialist for something, and they're getting better care for what they need somewhere else. But it's really fun learning that you've done something really helpful.
If you didn't, impacted his whole 12 years of school,
Yes. Yeah. And how different his future may look just by getting that first eye exam.
Another question I had was, how has screen time affected children's vision and eye health? And are there particular guidelines you would suggest for parents, you recommend for healthy screen habits?
Yeah. Screens are always a hard conversation, because I think I have to respect that they're our world. We have them. We are going to use them. And unfortunately, we're all going to end up using them more than our bodies were designed to do. I think it's important that we have kids who understand how to use technology. It's going to be in their careers and their futures. But really the biggest thing is just the amount of time we spend on them is the problem. And I'm sure you have had other people on who have discussed this. It is just so much time during our day. I think in an ideal world, it's like you just delay the use of screens as long as possible with kids. But my kind of general recommendations is like absolutely no screens before age 2. From 2 to 5, I want to try to limit it to an hour or less a day. And then after that, honestly, for the rest of our lives, we're supposed to try to limit it to 2 hours a day, which most are doing that. But the less amount of time, the better. When it comes to how the screens affect us, we're obviously still learning. I'm sure some of this will change over my career. But right now, a lot of the information in regards to like actual eye health, we're not seeing anything that like screens are leading to diseases of the eye long term. We're not seeing increases in glaucoma or cataracts or macular degeneration, which is all really good news. A lot of what I see is really just kind of this like day-to-day short-term effect on eyes. And again, we're spending too much time in front of them. We're often in poor postures and like positions when we're on them, especially like if you have like a teenager who's like curled up in bed with their phone really close to their face. Like these things are hard on the eyes. A lot of it is the screen fatigue, the headaches that we can get from them, the tiredness. And when we have that effect on our eyes day to day, we never really get a break that kind of allows our eyes to relax enough to see how we normally see. Another one of the really interesting ones is I'm actually seeing more dry eye in kids because of screens. So dry eye, I don't love that term. I usually like to talk about it as like dysfunctional tear film, because not all people who have dry eye feel dry. But our tears are super important for the comfort of the surface of our eye, for the clarity in our vision. And when we are on a screen, we just stop blinking. Our usual blink rate is about 11 times a minute. It goes down to about twice a minute when we're on a laptop, computer, tablet. And so this really constant exposure of the eye surface, for one, it's going to dry the eye out. But on top of it, our blinking motion is important for expressing the oil glands that live in our eyelids. So when we're just sitting there with those eyes open and we're not expressing the glands, and we're doing this for hours at a time, we'll see those glands kind of just get like clogged up. The oil inside of them gets kind of thick and it just sits there. Typically, this is a conversation I would have with just adults as they continue on birthdays. Like it is a problem of aging. But now I'm seeing it in teenagers. And seeing these increase, like my eyes feel really like gritty. I feel like there's something in them. They're really red at the end of the day. I feel this like burning, stinging feeling. All of these dry eye symptoms that typically are more reserved for adults, I'm seeing them in kids too.
Well, that's good to hear. Like that, still be cautious of what your kids and when they are consuming it. Obviously, like you're on an airplane and they can't really do a ton. Like it's totally appropriate, but you're at home, it's sunny out and the kids are asking, can they play on their tablets or something? And really they could probably be outside. You like give in, you're like, sure. It's like choose your battles, right?
Yes.
So
it's recognizing that they're going to use them in school and that's kind of unavoidable and we'll often need them for homework, but like all that extra time, what can we do there to minimize it? The more hours we're on the screen, the more we're going to see problems. And so cutting back as much as we can is really important. I love asking families, like I'll ask the kid first, like how many hours a day do you think you spend on the screen? It's always like, 2. The parent will go, no, it's probably more like 6. And then we'll step back and we'll go, okay, so you're thinking 6 because of what you see outside of the school day. But like when we add it up, a lot of our kids, even at young ages, are on the screens 10 hours a day. It's hard to change. Not all of it's in our control, but just like recognizing that all of those hours that are not necessary, where can we cut those back at?
We're hearing a lot about an epidemic of myopia, especially in younger generations. What's driving this trend and why is it concerning? And can you explain what myopia is to some of our listeners?
So myopia is what most people are going to refer to as nearsightedness. Basically that difficulty to see things far away. You can see up close, okay, distance is really blurry. We are seeing nearsightedness come up because of the screens. In reality, it's not just the screens, but it's sort of what has really spurred it to progress faster. We know that the amount of time we spend up close doing near work, so whether this is reading, crafting, being on the screens, the the visual signal that our brains and our eyes are getting from doing all of this near work leads to a growth change in the eye. It basically makes the eye like elongate and lengthen. And this is where prescription comes from. A nearsighted eye is essentially just an eye that's too long. And so we use the glasses to move the image where we need it in the eye. The numbers on this are pretty crazy. So there's a few different studies that kind of get all around the same area here, but basically if we compare nearsightedness from the 1960s to about the 2010s, in the 60s, we had about 33% of high schoolers in the US were nearsighted, with a really small percentage of those, about 2%, who are what we call high myopia, which is just above a certain prescription, with more health problems. So in the 60s, 33% and about 2%. In the 2010s, we were looking at about 58% of high school teenagers were nearsighted, and about 8% were in that high myopia category. And that 8% still sounds small, but that is like a 200% increase. That is a lot. And just around the world, it is just increasing in every country. We're expecting in about 2050, in about 25 years, for almost 5 billion people, or about half the world's population, to be nearsighted. And on its head, some people might say like, okay, we just need glasses to see. And for some people, that's not a big deal. But it's a lot bigger than just needing that prescription help to see clearly. A lot of it comes down to, long-term health of the eyes. As that eye continues to lengthen and elongate, the tissue inside the eye is not going to keep generating more to keep up with that growth. We're going to see it actually start to thin and stretch, and we get these really increased risks for retinal detachments, glaucoma, macular problems that are really devastating. And a lot of these aren't going to occur until later in life, but we have to think about our kids having 70-year-old eyes one day, and we also want them to see well and be able to do the things they enjoy. Higher numbers mean more people in glasses, but it also means we're going to have a lot more health problems that affect quality of life for patients. And some of those things are not fixable. They're not fixable by glasses. They mean impaired vision we just can't see anymore.
As we kind of start to wrap things up, what are some of the top things we can do as parents to help our kids protect their vision from an early age?
Yeah, there is a lot of the basic things that we're, going to hear from all of our healthcare providers. Diet and exercise are very helpful for eye health. Teaching kids proper food nutrition plays a pretty drastic role in that, like retinal health, the internal health of the eye. Sun protection. Our eyes can't have sunscreen on them, but we can get cancerous changes inside of our eyes from the sun. So wearing sunglasses, even from a really young age, is important for keeping that retinal health good. Screen time always comes up. Good hygiene is really important. So rubbing of the eyes and, learning not to share things that touch the eyes is really important. Rubbing is a fascinating one because we might just think like, oh, we're just tired, we're itchy, we might have some allergies. But really consistent eye rubbing can actually change the shape of the cornea, that clear window on the eye, and lead to a condition called keratoconus. This is really detrimental to the vision. It makes it really hard to correct people and have them see clearly, and the cornea will start to thin. And rubbing can be like the big factor for why it happens. So just like good hygiene around how we care for our eyes and touch our eyes. And then outdoor time is always a good one. Just getting outside helps decrease our risk for developing a few different conditions in the eye too.
Oh, those are all good, such advice, especially parents that are dealing with allergies in kids and they constantly see them like rubbing their eyes.
Yes, I know it feels good, but don't do it.
Alrighty. How can Erie residents get in touch with your office or learn more about the services that you provide?
Yeah, our website provides a bunch of information. It's summitvisioncare.com. We do also have a really wonderful team here where if you want to just like talk to a person, maybe the information's not on our website, giving a call. A lot of our staff here is going to be able to answer a lot of questions about what we provide. Or if you feel like it's a question that's maybe more appropriate for a doctor to answer, you can always email it in. And sometimes that gives me a better chance to sit down, write out a complete answer and all my thoughts, instead of trying to like play phone tag with you. Email's also a great way to get in touch. We did recently add online scheduling to our website, which has been really exciting. So you don't have to call us to set up an appointment. It can be done online now too.
Okay. Well, I'll make sure to include your website and everything in the show notes. But thank you so much, Dr. Rohr, for sharing all of these insights with us today. I'm really looking forward to airing this episode as we head into the back to school season. So many families have a helpful resource when it comes to understanding and supporting their children's vision. Your expertise and care truly make a difference in our community. So thank you for being on the show.
Thank you.
All right, friends, before we wrap up, here's the part I need to read to you. You know how it goes. This podcast is presented solely for educational purposes. I am just your friend behind the mic. I'm not a licensed therapist or doctor, and nothing you hear here is meant to replace the advice of a physician, professional coach, psychotherapist, or any other qualified professional. Thanks so much for listening, and I'll see you back here in the next episode. That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.